We spoke with Janet Gidner, mother of Addison Gidner, and asked her to tell her story.
My name is Janet, and I have two children with type 1 diabetes. I have a 7-year-old daughter who was diagnosed when she was 15 months old, and I also have a 2.5-year-old that was diagnosed about 4 months ago. We check their blood sugar immediately when they wake up. Then we have to calculate carbohydrates for what they're eating, give them an insulin dosage based off of what their current blood sugar was and what we think they're going to eat. It's a constant guessing game. So then we have to check their blood sugar every couple of hours. We have to do corrections all day and all night. My 2.5-year-old son was just diagnosed, 4 months ago. And he cannot communicate how he's feeling or his health. So it was very important, based on the numbers we were getting from his meter, that we had to get some technology to help us. We actually contacted our endocrinologist and said, we need a continuous glucose monitor. So with that, we also added my daughter to one as well. And looking back, I don't really know how we survived without it. It's an important piece of technology. It gives us, not only does it give us what her blood sugar is, but it also alarms us if their blood sugars are going too high or too low. It also gives us trends to see what direction their blood sugar is heading. Having a continuous glucose monitor gives us a great peace of mind. It gives us a little bit more freedom. We also, especially when our children are playing, my 7-year-old can go outside and play, and knowing that she's wearing the device close by. So it also helps when she's at school or at night too. Nighttime is key.
We asked Addison, Janet's daughter, what it was like before she got the Dexcom monitor and then after she got it on, and how it makes her feel.
My parents had to stay close to me all the time, so I couldn't play with my friends as much. All my friends could play outside, and I have to stay in my house. Now I feel more free, and I can run and play, and that kind of stuff.
Addison, how does your little brother like the monitor?
He likes it too, because he can play outside with my friends too, so I could stay close to him and he could stay close to me. So
before the Dexcom monitor, we were giving them finger pokes to get a reading on their meter 10 to 12 times a day at least. So that goes into the nighttime as well, because diabetes doesn't sleep. Now that we have the Dexcom, we still do the finger pokes in the middle of the night, but we can rely on the trends of it and know that our children are safe and not do as many finger pokes. It is the best decision we've made based on their diabetes.